Guys, so today we're playing this game and it's guess the condition. So I'll hopefully get it right. I'm a little bit rusty on my clinical skills because most of my work is procedural, but let me give this the best shot I can. So let's go. Okay, so this one, the first one, the diagnosis is male pattern hair loss, androgenetic alopecia. Looks like he's got a freaking full head of hair. So if I were to guess with this, I would say probably oral minoxidil and maybe topical minoxidil. But he may have had other procedures like PRP as well as something called Regenera. So guys, I'm blind to this, so I'm just going to see what's the actual treatment itself. Holy moly, growth factor. So growth factor injections for baldness. Let me comment about this. First of all, PRP doesn't work. Look, I think the science for the use in male pattern baldness or female pattern baldness is there. I don't like using PRP for skin rejuve because I think it's pretty crap, but for baldness, I think it's a goer. So I think growth factor here is basically PRP. And the results, truthfully, after 4 sessions, that's unbelievable. That's only 4 sessions spaced 1 month apart. So the next one is this. Oh, it's Dr. Esh, my colleague, who's actually a hair expert. So she's done this. Okay, so diagnosis, it looks like lower lid laxity. There's lots of wrinkles there. The wrinkles are probably age-induced. She may have, it's a little bit too anterior, too forward for it to be wrinkles due to movement. So I don't think this is going to be a straightforward Botox or filler. My guess is probably laser plus some amount of dermal filler. So my guess is going to be laser resurfacing and maybe a little bit of dermal filler by Esh. Pick away, holy that's blown me, that's totally blown me out of the water. So pick away, let me comment about this. The results are unbelievable because when you look at the wrinkling, I thought the only kind of laser that can help with this wrinkling is with something like a CO2 or even another fractional laser. But to get this with 1 session of pick away, okay, I'll eat humble pie and say that's a really good result, Ish. Okay, next one. Oh, this is mine, so I know. So this one, man, I mean, the result's freaking awesome. Hey, I mean, absolutely awesome. But this one is probably TCA and CO2. I remember doing this like ages ago, and maybe I'll finish off with a bit of pico. So this is basically superficial scarring, boxcar scars, and large pores, pick scarring. I've used TCA, probably as a TCA paint, and then use a CO2, small spot CO2, and finish it off probably with pico. There we go. Laser resurfacing and TCA paint. Okay, next one. That's a good result as well. Okay, the upper eyelid, so the diagnosis is laxity, so she's got laxity of the upper eyelid, lower eyelid. The upper eyelid, I think to get that kind of lift is probably surgical blepharoplasty. The bottom lid, she's got lots of laxity over there. I would say fractional laser or fully ablative laser, either CO2 or erbium. So I think there's 2 things. Surgery and laser. There we go, surgery and laser blepharoplasty, 1 session. Cool. Okay, the next we have is this. I'm pretty sure this could be a case of mine from years back. One of my favorite procedures is lip lift, upper lip lift. So I'm pretty sure she's had that because her lips are everted in the after photo. And the height between the upper lip and the nose has been decreased. So definitely this would be in a surgical lip lift. I think the results are okay. And her skin's markedly improved. So I think this would be a laser procedure. Given the amount of reduction of wrinkles, I'd probably say I did a ablative laser, probably CO2 or erbium. So let's look what I did. Ablative laser resurfacing, I didn't tell which type. 10-day recovery and a lip lift. Guys, those are some cases which I think some were great and some were really surprising. So I hope you enjoyed that. More to come in the next few videos. Catch you then.